Respiratory therapists have always been beneficial at the bedside due to their specific expertise. We have a very invasive scope of practice, so we do a lot of technical things such as intubations, invasive line placement, but primarily we manage ways we put air inside of people, so non-invasive ventilation, invasive ventilation. With COVID-19, our roles have been highlighted significantly due to the nature of the pathogen, where it affects the body, primarily the lungs, and also systemically, and how difficult it is to keep these patients going with their severe resultant hypoxemia from infection. So our expertise is very important in that realm. We spend a lot of time focusing on the lungs and the heart. Program is a very interesting program, as well as our current MSRC program. So it's interesting in the sense that we are working with practitioners who have experience in the field. Oftentimes, if you look at nursing schools or other things of that nature, we're taking in entry-level students, so freshmen in college, for example. We're dealing with a student population that has experience and wants to improve their career, but at the same time, we have to not focus on foundational information. So the experience in the BSRT program, personally mine, was more of a foreground development versus understanding foundational concepts. So it helps you build upon the intricate ideas in respiratory therapy and actually medicine in general, developing research, developing management skills, and developing communication skills as a bedside practitioner and as an educator, manager, and so on and so forth. So that's my experience and the current model we work under right now in the BSRT and MSRC programs.
Oh, that's awesome. Mm-hmm. Also, what would you say to prospective BSRT students or people thinking about going into it?
So we're at an interesting paradigm with what we highlighted with the importance or the significance of COVID and respiratory care and how we are in the limelight now. So we are actually seeing more entry-level applicants at the associate degree level and at other baccalaureate degree level respiratory therapy programs due to this unfortunate pandemic. But also those who are already in practice. Why should you get your BSRT? What's the point of it? We need to make ourselves more relevant and develop these secondary skills that allow us to critically think, that allows us to communicate, and allows us to be a more integrated part of the care team versus specific to the heart and lungs. That's what the BSRT offers. And so for those functioning professionals right now, that is what they're getting coming out of our program. They're better communicators overall. They don't work anecdotally. They work off of evidence-based medicine. And overall, this will better patient care and also satisfaction in their careers. This is going to sound kind of odd, but I developed a deep obsession with a measurement modality called esophageal balloon manometry. And it's an adjunct to measurements within someone's lungs. So if they're on a mechanical ventilator, we can see things from a whole different perspective. You almost get a view of the lung with a simple waveform. And so that really piqued my interest clinically, and the BSRT program helped me facilitate that thought process, develop that into a research question, and then it was all gone from there. So now I'm working on my PhD. I'm doing all these other interesting research ideas, but it started from a simple concept that was facilitated and giving one a new way to look at problems and how to develop your interests, and not only research, but it is your interest. It's not necessarily like, oh, I just have to do this because it's cool. So the BSRT program, with those previously mentioned aspects of developing your communication skills, developing your critical thinking skills, really lead one into that direction. Where you go with it is up to you. I mean, you don't necessarily have to be into research to benefit from our program, but that's how it works for me. Doing a lot of different research. Some is COVID focused and some isn't necessarily. So I currently have a funded study right now where I'm looking at aerosol deposition from the porcine lung model. So basically what comes out of the lung when you breathe. So we're looking at viral RNA particles or sequences collected on a filter, and we're using that to kind of determine how far these pathogens travel. The second phase of that study, we are utilizing nebulization. So it's a form of aerosolized medication, and seeing how that impacts how things come out of the body. So the second funding that we're looking for is actually an NIH grant that is pending. And we are actually looking at alternative ways of diagnostics with COVID-19. So instead of having something stuck in your nose or having blood drawn, we're developing a device and a way to use data science, and this is with the data science group, where one can breathe into a device and then we measure what's called volatile organic compounds. We look at these compounds and we can develop a profile of diagnostic potential. So we look at the PCR usually run, and then we'll look at what we have, combine the two for positive tests, and see what we come up with.